If you've looked at videos lately on YouTube, you've probably seen a lot of videos related to so-called miracle weight loss drugs. These drugs are basically fall into the category of what's known as glucagon-like peptide 1 agonists. What is glucagon-like peptide 1? It's basically called an incretin. It's kind of like a gut hormone that works to help you insulin work better. And in doing so, it maximizes insulin effectiveness, and it's very useful for treating people with type 2 diabetes to help control blood glucose. Let's say, for example, you have somebody who's either insulin insensitive, that's pre-diabetes, where you have higher resting blood glucose levels of between, let's say, 100 and maybe 117 or so. The fact that normal blood glucose is 100 or less. The ideal resting blood glucose would be in the lower to mid 80s. Very difficult to achieve that level of blood glucose. However, if you're on a high protein diet, for reasons I won't get into here, with a high protein diet, your usual, if you're not diabetic, your usual resting blood glucose will be in the low 90s. Very difficult. It has to do with certain amino acids that tend to affect the blood glucose. And of course, the more you weigh, the greater, the harder it's going to be to maintain resting blood glucose levels. However, this class of drugs called incretins, or glucagon-like peptide 1 agonists, were developed to treat diabetes, type 2 diabetes. And again, they work by making insulin more effective. However, when people started using them, they noticed a side effect that was unexpected. They started losing substantial amounts of weight. According to the medical journals, the most let's say one of the more popular GLP-1 agonists is called Ozempic, and the average weight loss is 15 to 20% of you lose over a couple of months. But again, the main purpose of these GLP-1 agonists is to treat diabetes. When the weight loss effect got out, however, people started using it strictly as a diet drug. In other words, most of these people did not have type 2 diabetes, but they were using it to lose weight. A couple of movie stars, Elon Musk, some of these people were supposedly using Ozempic to promote weight loss, and it got more and more popular to the point where pharmacies were having problems keeping Ozempic in stock. Now, Ozempic and similar GLP-1 agonists are not inexpensive drugs. They're peptides, which means they usually have to be given in a injectable form. The way Ozempic comes in a kind of a pen, and it's a very tiny needle. It's even smaller than an insulin needle, and you inject it in different parts of the body. Usually it's the abdomen. I'll get into that a little bit later. But the reason why GLP-1 agonists like Ozempic, and they later came out with one called Wegovy and Ozempic both contain the same active ingredient, which is semaglutide. However, Wegovy comes in whereas Ozempic, the maximum dose, I believe, is 2 milligrams. Wegovy goes up to 2.4 milligrams, and Wegovy is slated more for weight loss rather than diabetes, even though it's the same exact drug as Ozempic. It's in slightly stronger dose. Now, I'm not a pharmacist, and I'm not familiar with medical insurance, but I have a feeling that Wegovy is not covered, almost never covered under medical insurance. So whereas you could probably go to Ozempic if you are diagnosed with type 2 diabetes, you can get Ozempic, and not all, but a lot of insurance companies will cover it. The amount of money you pay for Ozempic will vary depending on what type of insurance plan you have. So, some of them are they give the Ozempic. It doesn't cost you anything if you have medical insurance. Others, it can cost as much as $250 for each pen that you get through a prescription. Again, it depends. I don't think that Ozempic is covered with government plans like Medicare, even if you have diabetes, but I'm not sure about that. But I know one thing, since Wegovy, again, same drug, semaglutide as Ozempic, Wegovy is slated strictly to promote weight loss. It was brought out when the drug company discovered how effective Ozempic was at promoting weight loss. They repackaged the same drug, they made it slightly stronger and called it Wegovy. It's the same drug. But again, because Wegovy is slated strictly for weight loss, I doubt it. I strongly doubt that you'd be able to get insurance to cover for it. And trust me, these drugs are not cheap if you don't have insurance. The average price of Ozempic varies from $1,000 to $1,200 a month. Wegovy, I'm not sure what the price is. I suspect it's probably about $1,500 a month. Now that's a lot of money to pay, if you don't have insurance. And of course, again, because they're peptides, they're always injected. Although there is a new form of semaglutide, which is in a pill form. I'll talk about that in a minute. It's a 50 milligram. They have to give a lot more of the drug in oral when you take it orally, because again, as a peptide, a lot of it will be degraded by the gut. So when you take an oral form, it's 50 milligram each pill to account for the fact that most of it's going to be broken down in the gut. So you still wind up getting about maybe 2 to 5 milligrams, the same amount as you get from the injectable form. Now, how do they make you lose weight? These GLP-1 agonists work by doing two methods. The first way is that they decrease hunger. They do that by sending signals to the hunger center in the brain, causing your appetite to decrease. And they also lower levels of a fat cell protein called leptin, which also affects your appetite. So the first way these drugs make you lose weight is by lowering your appetite. The second way is they impart a feeling of fullness to the extent that once you start using the drugs, you will not feel, it's almost like what they call bariatric surgery, where they tie off part of your stomach or intestine, they make your stomach, they decrease the size where it's only about it can hold about a tablespoon of food. So when you have that surgery, you can't eat much. You get full very fast. Well, these drugs kind of emulate that. They don't tie anything off, but they somehow impart the feeling of fullness, so you wind up eating less. So the net effect when you're taking these drugs is that you consume fewer calories. And of course, when you consume fewer calories, you're going to lose weight, and that's how you lose weight on these drugs. Now, there's been several things on Twitter and Instagram. They talk about some side effects. One of them they call Ozempic face. What this happens is that a lot of the people that start on Ozempic, again, most of them have a pretty good amount of body fat. As they begin to lose a considerable amount of body fat, let's say more than 30 pounds, when you lose body fat, you have to understand, you don't lose it in just one area. When your body gets rid of body fat, it's a systemic effect. You lose it everywhere. And one of the places that you lose fat when you diet or when you use a drug that causes rapid weight loss like Ozempic is you lose fat in your face. Now, the fat in your face actually disguises a lot of the lines and wrinkles that are already there. So a lot of the people that use, let's say, Ozempic, let's say they drop 30 pounds over, let's say 2 months, 3 months, whatever, they're going to lose a considerable amount of fat in their face. And what's going to happen is all the wrinkles and lines that were disguised by having the fat in the face are now going to be exposed, making them look considerably older. I mean, some people, it looks like they've suddenly gotten about 10 or 15 years older because they get this kind of old, wrinkles and lines come out in the face. The other side effect that people talk about is Ozempic butt, where they get, they lose, a lot of people, particularly women, hold a lot of body fat in their buttocks. And when you lose body fat, you lose it systemically all over. So if you lose 30, 40 pounds using one of these drugs, it's going to come off your butt too. And so your butt will tend to get smaller, and sometimes it'll actually get almost flat, Other times, especially if you don't work out, if your gluteus maximus is not, let's say, in good shape, when you lose all the fat, which is kind of making your butt look firm, now your butt will kind of look, when you lose all the fat, your butt's going to have a very saggy look. So they call that Ozempic butt. Now, I hasten to add that the Ozempic butt effect can easily be avoided if you do exercise. If you work out and do exercise that involve the gluteus maximus, such as squats, leg presses, most leg lunges, if you keep the buttocks in good shape with muscle tone, no matter how much fat you lose, you're not going to get the saggy butt. That only happens when you don't exercise. Now, where are the injections? Where are the sites? The injections are usually in the abdomen. Just like most diabetics, they have these small insulin needles, and they inject it directly in the abdomen. They're very small needles. You don't even feel it with insulin injections. Bodybuilders who use insulin will confirm that. Well, the GLP-1 agonists like Ozempic and Wegovy, they also are, the most common site is the abdomen. The needle is very, very tiny. You don't even feel it. But other possible sites include the upper arms, outer thighs, upper buttocks, hips, and lower back. But it's much easier to do it in the abdomen. As I said, semaglutide, that was found to be the first one that caused a considerable amount of weight loss. And I explained how it works, and both Wegovy and Wegovy is another name for semaglutide. As I said, Wegovy is also is not slated for type 2 diabetes. It's strictly to promote weight loss. It's also given once a week, and they give it to people who have a body mass index of 30 or higher, which is considered obese. I think that some people that have a large amount of body fat, where they get into the point where it's let's say they're a little older, where it can adversely affect health, they could possibly get a prescription for Wegovy. But you'd have to have a lot of body fat, because most doctors, or if you have, let's say, a related, what they call comorbidity, such as diabetes or hypertension, high blood pressure, you can also probably get Wegovy. However, it's, as far as it being superior to Ozempic, because it's a little higher dosage, we're talking 2 versus 2.4 milligrams, it might be a little bit more effective, but not much compared to Ozempic. It's almost the same. So, as I said, Ozempic is strictly the one for type 2 diabetes, but that's the one that it has a couple other effects. It seems to help prevent strokes. It seems to be pretty good for cardiovascular health. They had one of the original ones of the GLP-1 agonist was called liraglutide, and that's under the trade name Saxenda, and that also works by stimulating your pancreas to make more insulin when the blood glucose levels are high. In other words, the same mechanism as semaglutide or Ozempic and Wegovy. It also promotes weight loss. A 2022 Belgian study looked at the effects of Saxenda in 115 people with obesity. After 4 months, the group's median body weight had decreased by 9.2%. Now, this compares with the average 15 to 17% of semaglutide. So, liraglutide is not quite as effective at promoting fat loss as semaglutide. So, it's very rarely prescribed for that. It's also available under another trade name called Victoza, but Victoza is not approved for weight loss. There's still another kind of so-called weight loss drug called tirzepatide. Tirzepatide is sold under the name Mounjaro. It differs from the other GLP-1 agonists that I just mentioned because it also affects another incretin or gut hormone called glucose-dependent insulin polypeptide, and it works similar to that. So it's called a GIP agonist. So this drug, Mounjaro, affects both GLP-1, which is glucagon-like peptide, and glucose-dependent insulin-trophic polypeptide, or GIP, which also makes insulin work better. This particular drug, Mounjaro, is by far the best drug for promoting weight loss. The early studies showed that people using it lost 20% of their weight in about 18 months. The Mounjaro is actually approved by the FDA to treat diabetes, to help people manage their blood sugar, where other drugs such as metformin don't work as well. Again, it's injected once a week, just like the other ones. It also slows the digestion, makes you feel full, and also results in little appetite suppression. So they did a literature review to find out which are the best of these various so-called diabetes weight loss drugs, which one was the best for weight loss. And this literature review, published in 2022, found that Wegovy worked best for weight loss when compared with placebo. They also showed that Wegovy produced greater weight loss compared to Saxenda, which is, again, Saxenda doesn't work. Wegovy lowered the risk of death from heart attack in people with diabetes, and also lowered the rate of non-fatal heart attack and non-fatal strokes. So that study did not include Mounjaro, but a study in 2022 found that a low dose of Mounjaro, 5 milligrams, was as effective as 2 milligram dose of semaglutide, but the higher doses, 10 to 15 milligrams of Mounjaro, were more effective. So now I should also point out that you have to understand there's been these oh, it's a miracle thing, and they have a lot of MDs that are making YouTube videos extolling the virtues, and you should look at obesity as a disease, and just like you take drugs to treat other diseases like high blood pressure and cardiovascular disease, there's nothing wrong with taking a drug to help you control obesity or overweight. Now, there's a certain amount of truth to that, but there's also true that you have to understand that when you get off these drugs, and a lot of people, especially ones that don't have insurance paying for it, or maybe the insurance will limit how much you could use of it, once you start having to pay the extremely expensive price of these drugs, which again could be as much as $1,500 a month, a lot of people will get off the drugs. Now, what happens when you do? Well, it's kind of like that story, I think it was Cinderella, if you remember, when the pumpkin turned into a stagecoach, and then at the stroke of midnight, the stagecoach turned back into a pumpkin. That's what happens with these drugs. When you get off the drugs, in 9 out of 10 cases, all the fat and weight that you lost will return. Same thing that happens with crash dieting. The Biggest Losers, the TV show, most of the contestants on there who lost as much as 100 pounds, they all gained it back within 1 to 3 years. Crash dieting almost always fails because you lower your metabolism. Now, these drugs aren't lowering your metabolism, but they're creating conditions that make it possible for you to keep the weight off and not overeat. For example, making you feel full and also lowering your appetite. But when you stop using the drug, those benefits disappear. So there's also a great chance of regaining the weight. The only possible way to keep the weight off if you get off these drugs would be to radically change your eating habits and your physical activity habits. You'd have to eat less food than you did before. The amount of food that made you overweight or have too much body fat, you'd have to reduce that, and you don't have any drug to help you. It will take willpower, and after a while it becomes easier, and you'd absolutely have to work out. As a matter of fact, if you don't work out, and I'm talking about resistance training, lifting weights, if you take any of these GLP-1 agonist drugs, whether it's Wegovy or Ozempic, if you don't get involved in a weight training program, 40%, up to 40% of your weight loss will be muscle. That's very bad, because when you lose muscle, your resting metabolic rate goes down, which means your chances of becoming overweight are almost guaranteed. I mean, gaining the weight back are guaranteed. So that's one of the drawbacks. They don't tell you this in the rah-rah videos where they rave about how great these drugs are. They don't tell you about the possible loss of muscle and the fact that you're going to have to completely retrain your eating habits and exercise habits when you get off the drugs. Now, just like there's a saying in pharmacology, that an axiom, I should say, in pharmacology that says that if a drug doesn't have side effects, it doesn't work, period. And there are a number of side effects related to GLP-1 agonists, including nausea, vomiting, diarrhea, dizziness, increased heart rate, headache, stomach upset, and infection. Now, it should be I should tell you that one of the reasons, for example, if you start taking Ozempic, for the first month or 4 weeks, you start out at an extremely low dosage, 0.25 milligrams. 0.25 milligrams is not a therapeutic dosage. It's not going to help control your glucose much, and it's not going to help you lose a lot of weight. But what it does is it allows your body to get used to the drug, which minimizes the chances of side effects when you increase the dosage to the next level, which would be about 1 milligram. And if you do get side effects like nausea and vomiting, they're very short-lived usually. As you continue to use the drug, these side effects almost always disappear. The biggest danger with GLP agonists is if you have a certain type of genetic risk for thyroid cancer and medullary thyroid cancer. If you use these drugs for long term, that's another problem. If you use them for 1 to 3 years, you have an increased risk of getting thyroid cancer and another type of thyroid cancer called medullary thyroid cancer. And usually those are genetically based. So what this means is, very simply, if you have anyone in your family, any close relative who's had any type of thyroid cancer, you should never ever go near these drugs, because you probably have, let's say, a genetic tendency towards developing thyroid cancer, and if you take these GLP-1 agonists, there's a good chance that you will get thyroid cancer. So it's completely contraindicated for anyone who has any genetic tendency towards any type of thyroid cancer. If you take the drugs, if you have symptoms that include severe abdominal pain or an allergic reaction such as swelling of the eyes, mouth, throat, face, ankles, feet, or legs, or if you have problems breathing or swallowing, those are all allergic reactions. If you have fever or jaundice or clay-colored stools, that means you're having liver problems. That means you got to see a doctor right away and get off the drugs. So I have a little chart here which shows this is in May 2023. It says the typical monthly costs for the drugs. Ozempic was $935. Mounjaro was $1,023, and Wegovy is $1,349. As I said earlier, Wegovy would be the most expensive one because it's not really prescribed for diabetes. It's prescribed for weight loss. So right now, the only 2 of the drugs have official FDA approval, which is for weight loss, and that's semaglutide Wegovy form and liraglutide Saxenda. I would not even bother with Saxenda or liraglutide because it's not nearly as effective as the other drugs that I discussed. So I think that's about it for these weight loss drugs. They definitely do work. There's no question about it. They don't work for everybody. Now that's another myth that's people have this idea that somebody taking these particular GLP-1 agonists or GLP and GIP agonist drugs will always lose weight. For a certain small percentage of people, I'm not sure of the reason why, they don't get any effect whatsoever. They don't lose weight, nothing. They might help control blood glucose, but the weight loss effect just doesn't occur. Why that is a mystery. But generally speaking, for most people, they are effective. But as I said, they're expensive. If you don't have insurance, it's going to cost a fortune. And once you get off it, the weight's going to come back. And if you don't engage in a regular resistance training while you're on the drug, you're going to get side effects like the saggy butt effect and you're also going to lose about half the weight loss will be muscle. So keep that in mind. So that's about it. All I'm going to say for these drugs. I think they're probably really good. I personally think that the best use of these drugs is if you're, let's say, insulin insensitive, or you're, let's say, already have diabetes, and for some reason you're having a little trouble controlling your blood glucose. I think these drugs are very, very effective. They don't, they're not as dangerous as insulin, yet they will work with insulin to help you normalize and definitely control insulin, which is very important for health and longevity. So if you want more information about nutrition, exercise science, anti-aging research, ergogenic aids, hormonal therapy, supplement science, which ones work, which ones don't, effective fat loss techniques, women's health and fitness, all of these topics are covered in my Applied Metabolics, www.appliedmetabolics.com. It's 30 to 45 pages every month, no advertisements. I'm not associated with any supplement company. I'm not going to try and sell you any supplements or any other products. I'm giving you 100% evidence-based, truthful information, which is very rare these days because almost everybody is trying to sell you something. 90% of YouTube videos are nothing more than infomercials trying to sell you something. In my Applied Metabolics, it's the information that you really want. Practical information you could use today that will change your life. If you're involved in bodybuilding, you'll make greater gains. If you're trying to lose body fat, it'll help you lose body fat. If you want to increase your health and prevent degenerative diseases like cardiovascular disease and brain diseases like Alzheimer's, it's all in Applied Metabolics. It's the most practical, useful publication, and all of it is based on my over 60 years of studying experience that nobody else can match as far as I know. In fact, I do know that for a fact, by the way. So it's also written in plain English. I've been a professional writer for, I hate to say this, half a century. So believe me, I know how to write. I've written thousands and thousands of magazine articles, and and I've written on all different topics. I know how to write for the public. Any technical terms I use in Applied Metabolics, I immediately translate them for you so you don't have to reach for a medical dictionary. When you subscribe to Applied Metabolics, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information about nutrition, exercise science, and general health. I have an email portal on my Applied Metabolics webpage where current subscribers only can send me short questions about anything they might have read in Applied Metabolics or anything that comes to mind, as long as it's related to nutrition and exercise. I'll be happy to answer those short questions as a bonus for your subscription, and also because I appreciate your support of my work, which means that I don't answer unsolicited questions. I'm sorry, I don't. My subscribers come first. However, you are welcome to leave comments under these videos, usually suggesting topics for future videos. If I feel that the topic would interest a large number of people, I will try and do a video on it. Also, if you think my videos are of value to you and would be of value to others, please let others know about my YouTube channel. And of course, subscribe yourself. I post new videos every Tuesday. As you notice, anyone who's been a subscriber, who's seen some of my videos, I am completely uncommercial. I don't push any products. I won't mention brand names. I'm not a paid shill for companies. I'm not going to deceive you and try and coerce you or bullshit you into buying a product. I only tell the truth. I think I'm one of the last people on the internet that is telling the truth about these subjects. So please subscribe to my Applied Metabolics, www.appliedmetabolics.com, and also subscribe to my YouTube channel, this one that you're looking at. It's completely free. So I appreciate you listening. If you want to have the best friend you'll ever have, go to your local shelter and adopt a dog. They are the best. Take care.